Hi, it's Harriet. I made a video like this for my group, Positive Parenting with Food Allergies, but I wanted to make a video that I could share more publicly on the basics of what asthma is and touch very briefly on why asthma is such a big risk factor for someone who has food allergies. Normally, I do this workshop in about 15 to 20 minutes, maybe even a half an hour. I'm going to try to do this within 10. If you have any questions or comments, please send them to me. Please join Positive Parenting with Food Allergies. We are a group that is different than others, how we live life with food allergies, but I also do a lot of asthma education in there. I am an asthma educator. I have been a lifelong asthmatic my entire life. I have been doing asthma education one way or another for almost 20 years. This is my little training bag. So instead of giving a whole lot about me, I want to talk about what asthma is. So asthma is a chronic condition that affects your respiratory system. There are many different ways that asthma presents. It's not all the same for every single person. There are many triggers for asthma, and I want to talk about that. One of the things that's really important about asthma is that you understand what is happening inside your bronchial tubes at that time, and I am going to use my handy dandy little demonstration model. So this is a healthy bronchial tube. This bronchial tube notice it's pink, it's open, the air is flowing through, there's no mucus, it looks friendly. This one is a bronchial tube that is not so friendly. This one is someone who's got a lot of inflammation. Notice the hole is much smaller. Notice that there is mucus in this area. And notice that this is more red. Notice that this is even more red. And you have more constriction going on. So that means that this is tighter. You have less airway for the air to flow through. This is, again, what a healthy bronchial tube looks like, and this is what someone who has asthma that's not well controlled looks like. So picture this. You're already breathing with less function. When you are exposed to a trigger, if you are already inflamed, you get more inflamed. Your airways become spasmodic, as I'd like to say. They start, other people who don't necessarily have asthma, they are told they have reactive airway disease, which is really not a thing. But what happens is that your airways are getting more inflamed and the airway is becoming more narrow and filling with mucus. Triggers for asthma can vary from person to person. It can be exercise, it can be the weather. If it's going to rain, some people wheeze before a thunderstorm if there's a barometric pressure change. If it's too cold outside, that can irritate the airways. If there's a temperature change. People obviously know that mold and environmental triggers like cockroaches, dust, those are what we call environmental triggers. Other things that people don't necessarily think about, which happens to be one of my triggers and my kids' triggers, laughing. Laughing causes, if I laugh too hard, I need my inhaler. Crying can do it. Emotional changes can definitely trigger an asthma attack. Nowadays also there's many different types of asthma that we're treating that have different biomarkers, which is a little bit different, which I'll go into that later. But your main triggers are environmental, weather, exercise. I have cold-induced asthma, which is not the temperature, but if I get, or people, it's called viral-induced asthma, meaning if I have a viral infection, that triggers my asthma. There are many people who can be fine around environmental triggers and only have viral induced or exercise induced. So it's important that you learn what causes your flare. Now, when we're talking about food allergies and asthma, one of the important things that people don't get is that it's a dangerous combo, because I want to go back to my model. If you are already like this, let's say you've been having poorly controlled asthma, and you're having frequent use of your rescue inhaler or nebulizer, that means you're kind of like this. And if you are like this, if you're not under good control, if you're not taking your controller medications, that means that if you get exposed to let's say one of your allergens, it's going to take less time for you to lose your airway than, say, if it was somebody who was like this, because you're already starting with a point where it's very narrow. That is why we stress for people when they're exposed to a trigger. This is why we stress for people to have long-term controller medications. So what are long-term controller medications? They are medications that you take every single day, even when you feel well. And there are many different kinds on the market now. There are inhalated corticosteroids ones. There are combination drugs that have inhaled corticosteroids and a long-acting beta agonist. An example of that, here is a sample of like Advair. This is a discus, and this is a sample of a combo medication. A sample of a single medication is like an old version of Qvar, which is just an ICS, which is just an inhalated corticosteroid. But there are many other medications on the market, and they are either combo or single, depending on what you need. If your doctor feels you need more coverage, you would then get a combo. For some people, just an inhalated corticosteroid would be enough. You also have different types of drugs like Singulair, which is a leukotriene modifier, which works by a pill, and that triggers other areas in the body to prevent a response. But inhalated corticosteroids are used to keep inflammation down. And it's really, really, really important to keep that inflammation down, because if you get exposed to a trigger, you will have more airway to work with. Now, rescue inhalers are great, but if you're using them more than 2 times a week, then your asthma is really not controlled and you really do need to talk to a doctor. But you should always carry your asthma inhaler, your rescue inhaler, with you, because you never know when you are going to be exposed to a trigger. You could be walking in a mall and all of a sudden they're spraying something that you're allergic to, or you could suddenly be somewhere and there's a thunderstorm approaching and you start wheezing. One important note, not everybody with asthma wheezes. Sometimes you're too tight to wheeze. And so wheezing is not always a sign. This is why it's really, really important to talk to your physician. Another way to monitor your asthma is this little device. They look different. They are called peak flow meters. You can find your goal, your best, your personal best, and monitor daily. If you see a change, that might be a time to talk to your doctor. If you start seeing the numbers go down, that might be time to be more cautious. And also, if it's really low, then you follow emergency procedures. This is generally used with an asthma action plan, which is color coded, like green, you're good, yellow, something starting, and red, you're in trouble. So this is a great tool to ask your physician for. Another thing that is very, very important, very quickly to mention, if you are taking those inhalers, you should really be using a spacer, and spacers are only available by prescription, so your physician needs to write this out. But you spray, you put the medication, actually this one is a better one. You would put the medication on this end, and then you put this end in your mouth, and when you spray it, the medication stays trapped in here, so you can take your time and breathe it in, whereas most people lack the skill to take the medication appropriately, and what happens is they do it like this, and then they're holding it, but most of the medication gets out in the air. The best thing about a spacer is that this traps the medication, ensures that you're getting the right delivery, and that you're taking the medication the correct way. Most asthmatics, when they say that the medication's not working, it has to do with the fact that they're not using their inhaler the right way. So every visit, either the provider or the asthma educator should be assessing that the patient's technique is correct. Now, going back to food allergies and asthma, it is important to note that on a fair allergy action plan, there is a box to check if you are asthmatic and have food allergies, because you are then at significantly higher risk of a severe reaction. So it is very, very important to know that. Unfortunately, the symptoms of anaphylaxis and asthma can sometimes mimic each other, and too often people run for their inhaler. An inhaler, just so you know, an inhaler does not treat systemically. It will not treat the rest of the body. It will not treat if there is swelling going on anywhere in the throat. It will not treat hives. It will not treat vomiting. It will not treat low blood pressure. The newer inhalers are really, really good at just targeting the lungs, but they're not going to target it enough to keep the airway open. Years ago, asthma was treated with epi. Epi was the drug to use when people were having severe attacks. So if it is someone who's in doubt, follow that action plan, but make sure that you check off if you have asthma and food allergies. I think I'm at 13 minutes, so I want to cut this a little shorter because I don't want to bore people. I have a lot more to say on asthma, and I would be happy to share it, but I just wanted to get this quick info out just so people had a visualization of what asthma really looks like, and talk a little bit about the different medications. But if you'd like to go, if you'd like me to go in more detail about the different types of medications, what they look like or what they do, let me know. I'll be happy to do that. If you want me to talk more about food allergies and asthma or just food allergies, can do that too. Just let me know and I will help you out. Bye.